Concussions in professional sports have been in the headlines in recent years, but did you know that here in New Mexico, we require that youth athletes sit out for 10 days after a concussion? That requirement was passed by the legislature and went into effect in 2016, and we were curious about how the law is being implemented. So we asked our newest correspondent, Khalil Ekalona, to check in this week with a medical provider and coaches about how they are helping prevent concussions and better address them when they do happen.
I'm joined at the table by Dr. Richard Campbell, a pediatric neuropsychologist at the UNM Health Sciences Center and professor of psychiatry and behavioral sciences, Brandon Chavez, director of Spirit Expressed West, and Lucian Starzinski has coached soccer at many levels, including the state and club soccer. He's currently soccer coach at Albuquerque High. Dr. Campbell, let's start with you. What sports put young people at the greatest risk for concussion?
We know that football is primarily the greatest sport that is at risk for concussion. But we also know that sports such as soccer, and lacrosse, other sports that have a lot of physical contact are also at risk for concussions. We know that sports and recreation such as cheerleading, wrestling, even data in females are at risk for concussions.
As well, and basketball and other sports.
Yes.
So almost the entire gamut of sports is something where
yes,
students are at risk.
And we know that most concussions occur from athlete to athlete contact, with the second being athlete to some physical barrier on the field.
Now, is this only for athletic sports? What about possibly being in physical education class in high school?
We recently did a study looking at the incidences of concussion in our middle and high school students here in New Mexico, in which we were interested in looking at the incidence of concussion not only in sports, but we also asked about physical education. An area that really hasn't been researched much, and we found that our students who are participating in physical education may be at a higher risk for having concussion than individuals who are participating in sports.
And Brandon and Lucian, so you're a cheerleading coach and soccer coach respectively. Do you find that's similar, possibly more increased risk of concussion for the kids you work with?
Absolutely. Yeah, I mean, I'm not sure like how familiar you are with cheerleading as a sport and what's involved, but like things like basket tosses where you can toss somebody up to 20 feet in the air and you have to catch them. I mean, there's a lot of risk involved.
Yeah, I've seen the competitions on late night on television, and it's a high impact sport. It's not just rah rah sis boom bah on the side.
Right.
Yeah, it's intense. What about in the soccer field?
Yeah, and no question about it, like Dr. Campbell said, I've seen quite a few concussions. This pretty soon my 20th year coaching. It's going to come up pretty soon here, and I've seen a lot of concussions. And it's exactly like Dr. Campbell said. It's player to player contact. It's players lose their footing and the impact on the ground, or a quick turn and there's that impact into someone, or that kind of contact. I haven't seen, and I'm sure it happens, or I assume it happens. I've never seen a concussion because of contact with a ball, with an object. It's always that player-to-player contact.
You've been coaching for 20 years. Are you seeing more concussions today than before?
No, because the game hasn't changed. As long as the game is, and I'm speaking specifically about soccer right now, as long as the game is the game, I mean, the game hasn't changed that much in the past, 50 years.
Yeah.
And as long as the game is the way it currently is, that player-to-player contact will always be there, and there will always be the risk of concussion. Yeah. And the truth is, no matter what you do, you will not be able to eradicate that from the game.
Yeah, and pretty much all sports, as long as they're played the way that they are. Now, Dr. Campbell, what are some of the signs and symptoms of a young person having a concussion?
So a concussion is a mild traumatic brain injury. that occurs as a result of some sort of a blow to the head or some sort of a hit or jolt to the body that causes the brain to move within the cranium, and then causes chemical changes in the brain. Signs and symptoms, the most common is headache, but also see things such as sensitivity to light, to noise, dizziness, confusion, ringing in the ears. There's there's numerous sort of symptoms and signs.
What are some of the risk factors that can make a concussion worse?
That make in terms of, are you speaking to prolonged symptoms?
Prolonged symptoms, and perhaps a student, a young athlete is playing basketball, for instance. They hit their head on the floor, they're diagnosed with a concussion. What are some of the risk factors as far as, obviously we don't want them to go back immediately and begin playing again, but something that can exacerbate the danger of the symptoms of being a concussion?
Well, what we do want is to allow the athlete to recover and have the time to recover. And we know that the risk for a repeat concussion typically occurs within the first 7 to 10 days. And so we want to avoid that. And the risk factors for prolonged symptoms from concussion are things such as having a prior concussion. And we know that there's evidence that adolescents tend to be at higher risk for prolonged symptoms. In some cases, history of headache or migraine headaches. There's some evidence in terms of learning disabilities, ADHD, but that research still needs to be clarified better. History of either comorbid or premorbid anxiety, depression may be a bit of a risk factor for prolonged symptoms.
So definitely one of the risk factors that we want to avoid is having a student athlete continue to play once they've suffered a concussion or play too soon.
Correct, and that's has been the reason for state concussion laws being developed, is to help in terms of reducing the risk of repeat concussions and allowing the student athletes to recover.
Now, switching gears a little bit to go to the people on the sidelines and competing. Brandon, you've been working with dancers and cheerleaders for quite some time. What are some of the key ways that you're helping the dancers and cheerleaders kind of avoid concussions?
The best way to avoid it is to follow progression in stunting for cheerleaders. A lot of kids get really excited. They see these competitions like you mentioned on TV, and they want to do what they saw on television, but they don't understand that there's up to a 5-step process to get to that level of difficulty. And they try to do things that are out of their ability level, and that's where injury happens. And so it really needs to be a coach's responsibility to step in and say, no, we need to follow these 5 steps. If you want to be doing a skill like that, then we've got to learn it this way, start on step 1, and we'll gradually get there, but you can't just jump in and start to do level 5 and expect to stay safe.
In essence, you have to walk before you flip.
Absolutely.
In that essence. Okay, now so tell me, when are they most likely to happen in cheerleading?
There's really no way of knowing when they're most likely to happen. I mean, there's so many elements to cheerleading. Like there's the tumbling element in itself, which is, one thing, and then stunting is a whole other animal, and I think that it just goes back to progression and coaches being educated and knowing, like, this is how you teach something.
Yes.
This is step 1, this is step 2, this is step 3. And it's a coach's responsibility. They have to follow them.
Essentially, it comes down to coaching the right way and the right technique, like in football, the proper ways to tackle.
Absolutely.
There's a proper way.
You got to start.
Do the stunts.
You have to start at step 1, and a lot of people skip step 1 because they're anxious and they want the immediate gratification of doing advanced skills.
Patience is one of the key to safety.
Definitely.
I understand. Now, Brandon, tell me, what about the soccer field?
Like I said earlier, I mean, I can look back at the last, 3 or 4 concussions I witnessed, and there is nothing we could have done to prepare them for that situation. There's just, it's unpredictable in the game. And like I said, so at the younger levels, U11 soccer now, you're not allowed to head the ball.
Okay.
Right? And that's an obvious step for the younger ones, like Dr. Campbell was saying, with taking a step to help with, you know, the developing brain at the younger ages. But as they get older into U13, 14, 15, 16, the concussions I've seen, there's no way to prevent it.
Yeah.
It's just completely unpredictable how they happen in the game.
Now, do you often get questions, both of you, do you get questions from parents as far as concussions, like what you're doing to try to mitigate them, how are they to be treated, and questions from parents of student athletes who've suffered a concussion?
Well, we do a really good job at Albuquerque High preparing the parents every season about what the protocol is and the return to play progression. I mean, the communication now is better than it's ever been, at least at our school in my program. So we prepare them for what will happen if they get a concussion. And what I've seen is that everyone, I think in the past 20 years, the biggest change I've seen is that people understand now that a concussion is an injury that should be treated like a torn ACL, like a rolled ankle, like a pulled muscle. I think that's the biggest change I've seen, is people understand, parents, players, it is an injury that has to be treated. And what I've seen is they have, at least in my program, they've got complete faith in what we're doing to treat that injury.
Now, briefly, do you all feel that the ethos, I know sometimes in football it used to be rub some dirt on it, get back out on the field.
Exactly.
Do you think that the culture among student athletes to, I want to continue to play for my team, for the school, for my parents, do you think that that's beginning to change a little bit?
I think it's different everywhere. You know, if you have a competitive program, of course the kids want to get back on the floor. Like that's what they're there for.
Yeah.
Not every program is an absolutely competitive program, and like in my experience, like soccer, everybody's competitive. You're playing games, but cheerleading quite isn't there yet. There's competitive teams and there's sideline teams. So maybe sideline teams, when it happens, the girls are scared and they really don't care to go back on the field.
I understand.
But the competitive people, they definitely want to be on the field. And it's almost like backwards from what he's saying. Like the parents are not always supportive on the cheer side, and they want their kids to be back on there, and they're willing to not wait the full 10 to 14 days. They want their kid out there like in 3 days, and you have to stop them and remind them that just because you can't see the brain injury the way you see a rolled ankle or the other issues, that it's still there, and you have to follow the guidelines.
Yes, and you mentioned 10 days before.
Our current state law is that a student athlete is not to return to play for a minimum of 240 hours or 10 days. We recommended that based on some evidence, including that we have evidence that, as I mentioned earlier, that the vast majority of repeat concussions occurs within a 7 to 10 day period after the first concussion. The second is that we know from some neuroscience research that it seems as though that 7 to 10 days is the time that it takes to recover from that biochemical metabolic crisis that occurs following a concussion. There was a recent study that was done, published in the American Journal of Public Health, that looked at the effects of state concussion laws. And happily, we've seen a significant decrease in repeat concussions as a result of these state concussion laws. I think the New Mexico concussion law also requires that not only coaches but parents and athletes be educated regarding concussion. It's important that we be aware of concussions and learn how to manage them so that we can encourage safe participation in sports for our kids.
Safe participation is definitely needed. Well, gentlemen, I want to thank you all for being with me today and having this great discussion. Hopefully we can begin to change some of the attitudes towards concussions.
Absolutely. Thank you.
Thank you.